We'd like to bring in CBS News political contributor and Washington Post White House reporter Sean Sullivan. Sean, thank you so much for joining us today.
Yeah, happy to be here.
I guess we'll start out by asking, what have we learned about Vice President Kamala Harris's COVID diagnosis, and how is the administration responding at this point?
Well, there are some things we know and some things we don't at this point. What we've heard from the White House is that the vice president tested positive, both on a PCR test and a rapid test. Today, the White House is saying that she was not a close contact of the president or the first lady. We know last week both the president and the vice president were traveling. In fact, they were both on the West Coast, but they were in different places. The vice president was in California, and President Biden was in the Pacific Northwest. He was in the state of Washington and Oregon. We know that President Biden spoke with Vice President Harris today. He talked to her by phone. He wanted to check on her, see how she was doing, and that her plan right now is to isolate, is to stay at her residence. And so she's not expected to be in any in-person meetings or anything of that nature. Now, there are things that we don't know. We don't know exactly how this happened. We heard White House Press Secretary Jen Psaki field some questions on this, but she didn't give a lot of clarity in terms of, what the events leading up to today were, what Vice President Harris's prior tests showed. We also don't know if she's taking any therapeutics right now. We heard Psaki say that that would be something that would be up to the vice president's doctor. In terms of the practical implications of this, in terms of what happens in Washington, one thing that has, I think, attracted the attention of some lawmakers on Capitol Hill is, of course, the vice president has a constitutional role where she can break ties. We have in the United States Senate. And so we have a 50-50 Senate right now, 50 Republicans, 50 Democrats. If there were a tight vote, and if the vice president were not able to show up, that could affect the legislative process up on Capitol Hill. But that's what we know so far. And so trying to get more answers about her status. And one other thing I would notice that the White House has also said that she had no symptoms, even though she had tested positive.
Right. All right. Well, to your point of how the White House is responding to all of this, the White House is also saying that President Biden and the First Lady were not close contacts or not being considered close contacts. Sure. Can you tell us a little bit more about that, Sean, and how the administration is preparing for the very real possibility of President Biden catching COVID?
It is a real possibility. And in fact, what we heard from Jen Psaki at that briefing was one of her most open acknowledgments I've heard yet, that is a possibility. She said that he is tested regularly. We, as members of the press, who are in the close press pool with the president, are required to be tested. And so we have seen the overall public guidance in terms of masking change over the months. But the White House has said, look, we're taking special precautions. But at the same time, the president is in a high-risk group. He's 79 years old. We know that the White House has said, look, he is fully vaccinated. He is fully boosted. They've said the same of the vice president. But they're openly acknowledging that, look, this could happen. But what we didn't hear from the White House today was any real indication that he was about to change any of his activities, at least in the near future. Psaki was asked about the White House Correspondents' Dinner, which is scheduled in Washington this week. And that's going to be a big room with a lot of people. The president is scheduled to go there. It didn't sound from what Psaki said like he was going to change his plans to do that. He's also out on the road a lot. And he's, in fact, expected to travel to Minnesota for the memorial service for former Vice President Mondale. And so, there are a lot of moving parts that happen around these presidential trips. It looks like the White House is saying, look, we're trying to keep him safe, but they're not in any real way, it seems like, pulling back from some of this travel and having him out there. There was a long period of time where they were a bit more cautious. We didn't see him hitting the road a lot. And then we heard the White House say, look, we want to get the president out there more. They have been doing that. The question is whether, as a result of today, he starts to get advice to pull back from some of that stuff. But again, no indications yet that they're prepared to do that. But they are acknowledging, look, that this could happen. There is a presidential line of succession. The vice president obviously has COVID right now. The Speaker of the House is after that. And so I think, this is something that is rightfully getting a lot of attention from people, given that a lot of these individuals are in high-risk groups due to their advanced age. And so we'll see, kind of how the White House approaches this, whether they shake things up or try to be more cautious in some outward-facing way in the weeks ahead.
Sure. And on that note, I mean, we heard Jen Psaki also ask there about if the White House is potentially going to be changing COVID protocols there or on the Hill because of this high-profile COVID case. Obviously not the first one that we've seen pop up even in the past few weeks in D.C.
Yeah, that's right. And, we've seen even today a study a public health study that shows something on the measure of 60% of people in the United States having had COVID. And so, this is something that has reached pretty far and wide in this country. Lawmakers, White House officials have been no exception. And now with Vice President Harris, we see, even a very, very high ranking member of the Biden administration has been no exception. And so it is worth watching to see whether the White House or whether, Capitol Hill, I think we saw a couple more Democratic senators today say that they had come down with COVID as well. It'll be interesting to see whether they adjust their protocols, because we have seen, the early parts of this spring, we've seen the country sort of open up more after the Omicron wave that we saw earlier this year. We've seen some of the mask mandates and some of the guidelines that were pretty strict in some places, at least relative to where they are now, be relaxed. The question is, what does the White House decide to do? What does Congress decide to do? They can ultimately make their own rules. They don't have to necessarily abide by public health guidance if they want to take more precautions. But I think this White House does want to send a signal that, look, the CDC offers guidelines periodically based on where we think we are in the pandemic, and they tend to try to mirror those guidelines for the American public. But again, I think, this diagnosis today by Vice President Harris, something that's catching a lot of people's attention. And so the question from here is, what does it prompt in terms of any changes?
Certainly gives you pause when the vice president catches COVID. All right, Sean Sullivan, thank you so much for your insight. We appreciate it.
Thank you.